In the labyrinth of medicine, some diseases lurk in the shadows, their existence known to few. These are the rare diseases, afflictions so uncommon that they impact a small fraction of the population. A rare disease, as defined in the United States, is one that affects fewer than 200,000 people at any given time. While seemingly insignificant in number, the collective burden of these diseases is far from negligible. Imagine a world where your own body becomes a battleground, where your cells betray you, and where answers remain elusive. This is the reality for millions of Americans grappling with rare diseases. These illnesses often manifest with a constellation of baffling symptoms, leaving both patients and doctors searching for answers in a medical maze. The rarity of these diseases presents a formidable challenge. Diagnosis is often delayed due to a lack of awareness and understanding among healthcare providers. Research funding, too, tends to be limited, leaving many patients with few treatment options and little hope for a cure. Yet, amidst the darkness, there is a glimmer of hope. The United States faces a diverse array of rare diseases, each with its own unique challenges. One such example is Huntington's disease, a devastating neurological disorder that results in the progressive breakdown of nerve cells in the brain. Patients with Huntington's disease experience a range of debilitating symptoms, including involuntary movements, cognitive decline, and psychiatric problems. Another rare disease that casts a long shadow is cystic fibrosis, a genetic disorder that affects the lungs, pancreas, and other organs. Cystic fibrosis disrupts the body's ability to regulate salt and water balance, leading to the production of thick, sticky mucus that clogs the airways and hinders digestion. Patients with cystic fibrosis often face a lifetime of respiratory infections, malnutrition, and other complications. These are but two examples of the thousands of rare diseases that afflict Americans. Others include sickle cell anemia, a blood disorder that causes red blood cells to become misshapen and break down, amyotrophic lateral sclerosis, ALS, a progressive neurodegenerative disease that affects nerve cells in the brain and spinal cord, and epidermolysis bullosa, a group of genetic skin disorders that cause the skin to be extremely fragile and blister easily. One of the most significant obstacles facing the rare disease community is a lack of awareness. Because these diseases are so uncommon, many people, including healthcare professionals, are unfamiliar with their symptoms and treatment options. This lack of awareness can lead to misdiagnosis, delayed treatment, and a sense of isolation for patients and their families. The consequences of this awareness gap are far-reaching. Patients may wander from doctor to doctor, their symptoms dismissed or misattributed to more common conditions. Precious time is lost, and the disease may progress unchecked, leading to irreversible damage. Furthermore, the lack of awareness extends beyond the medical community. Funding for rare disease research is often limited, as pharmaceutical companies and government agencies prioritize diseases that affect larger populations. This lack of funding stifles innovation and leaves many patients with little hope for a cure. Moreover, the social stigma associated with having a rare disease can be isolating and emotionally taxing for patients and their families. Addressing the challenges posed by rare diseases requires a multifaceted approach. First and foremost, raising awareness is paramount. Educating the public, healthcare providers, and policymakers about the prevalence and impact of these diseases is crucial for improving diagnosis, treatment, and research funding. Secondly, there is an urgent need for greater investment in rare disease research. Developing new diagnostic tools, therapies, and cures requires significant financial resources. Governments, pharmaceutical companies, and private foundations all have a role to play in supporting research efforts. Thirdly, fostering collaboration among researchers, clinicians, and patient advocacy groups is essential. Sharing knowledge, resources, and data can accelerate the pace of discovery and improve patient outcomes. Finally, providing comprehensive support services for patients and their families is crucial. Despite the challenges, there is reason for hope in the fight against rare diseases. Advances in medical research have led to the development of effective treatments for some of these conditions. For example, enzyme replacement therapy has transformed the lives of many patients with lysosomal storage disorders, a group of rare genetic diseases that cause the buildup of harmful substances in the body's cells. Gene therapy, a cutting-edge approach that involves replacing or repairing faulty genes, holds immense promise for treating a wide range of rare diseases. Clinical trials are underway for conditions such as cystic fibrosis, hemophilia, and spinal muscular atrophy, and early results are encouraging. In addition to these advancements, scientists are exploring new frontiers in medicine, such as personalized medicine and stem cell therapy, which offer the potential for even more targeted and effective treatments for rare diseases. While challenges remain, the future of rare disease research is bright with possibility. The journey of 1,000 miles begins with a single step. Similarly, the fight against rare diseases requires a collective effort from all sectors of society. By raising awareness, investing in research, fostering collaboration, and supporting patients, we can illuminate the shadows surrounding these conditions and pave the way for a brighter future. Let us strive to create a world where no one suffers alone, where diagnosis is timely, where treatment is effective, and where a cure is within reach for all who are affected by these enigmatic diseases. The power to make a difference lies in our hands.